Hi everybody, thanks for being here. I hope you're enjoying your dinner. Now that we've all introduced ourselves, I'll start the presentation, just a couple of words ahead of time. This is basically geared towards nurses at various levels of experience. It's all about discharge planning, as you can see. And it would be helpful for anyone, even an experienced nurse, and I know that patients with lots of needs in general, very high acuity, and lots of discharge needs. So hopefully there are parts to this that will help you in your everyday work. And if you're a little bit on the newer side, it'll definitely be helpful when you face these challenging patients that have lots of discharge needs. So I'm calling it the art and science of discharge planning, and I'll explain why soon. So for my introduction, I'm not going to really talk about discharge planning. I'm going to talk about the art and science of nursing. So for me, as an experienced nurse, I developed my nursing philosophy throughout the years, and it changes a lot as you move through different roles and different jobs. And I felt like that my approach to nursing, the art and science of nursing, helps me in all areas of nursing, especially really challenging areas. So I wanted to talk about my theories and my thoughts about art and science of nursing so that we could apply it, and you can see my approach to discharge planning. So let's do the science first, because it's not as much fun, but it's extremely important. So when I think of the science of nursing, I think about all of the guidelines and the protocols and the policies and procedures that we have to follow, and it's all usually evidence-based. It's proven that it works. Hopefully it's things that we are following that are proven to be the best practices. So they're very measured sort of interventions that we do. They're verified, and they're very logical, and some of them are very technical, some of the skills and the responsibilities that we have. So, of course, these are critical to nursing care. And again, you'll see that they're critical to the whole area of discharge planning. So then the fun part of nursing, in my opinion, is the art of nursing. So to this, I feel is great because you can bring your own flair to it, your own problem-solving skills, your own unique perspective, your own way of showing caring towards people and nurturing, especially with kids. It's great because you get to get down sort of to their level and do playful things, sometimes as therapeutic measures. So it's a really place that you can shine and show your personality. And the same thing goes for, again, the discharge planning. You know what's behind everything. You know all the science and the protocols and the procedures that you have to follow. But you have to bring your own sort of talent to it, because it's a lot of challenging work, and it's a lot of responsibility and collaborating, communicating, and it can be really frustrating at times to get everything done. So your own style is going to make the difference, and it's going to make it a much better experience for the patient and help the outcomes as well. So I feel like that's true for nursing in general, and then for specific areas, again, such as discharge planning. So those are my ideas about the art and science of nursing. So a little bit about how I developed my nursing philosophy, and I'm sure you all have your own version of your own nursing philosophy. So I looked at things like what matters to me, who are my heroes, and what is my nursing mission. And when I was out there looking for jobs when I was younger, I wanted my nursing mission to be sort of in alignment with the nursing mission of where I work. So when I came to children's, I felt like it really was. After so many years, I saw that the mission was similar to my feelings, the way the hospital operates. So for my heroes, as you can see, one of my heroes is Nurse Jackie. So I know that as far as the art of nursing, she was really good. She thinks outside the box, she has her own approach. She always solves the problem, and she doesn't let go of it until the problem is solved. So that part of her personality I like, and she's a hero to me for that reason. And I know she's fictional, but for the science, not so much, because she broke all the rules, she didn't follow any of the rules, and she got in a lot of trouble, and she was a drug addict. So you can pick and choose your heroes and what you like and what you don't like. And at the bottom, I included in the corner this book called The Florence Prescription. I'll talk about it for a second. So I just kind of discovered this book recently, and it's basically about the culture of a hospital or a unit where you work, and how you can change it into a more positive place. And it definitely talks about the philosophies and the communication that we use, and how we can basically work. It talks about fellowship. So I felt like that was sort of something I'm going to add a little bit more of that kind of concept to my nursing philosophy in the future years. So if anyone wants to know more about the book, I can either lend it to you I'll tell you more about it so you can get it. So that is my introduction. So now we can talk more specifically about discharge planning. So for the objectives for this class, I was reading a lot of articles, of course, and I found this one paragraph that I felt like really encompassed what the importance of discharge planning means to me. So the purpose of discharge planning is to ensure continuity of quality care between the hospital and the community. And in addition, the aim of discharge planning is to reduce hospital length of stay and unplanned readmissions to the hospital. So we hear a lot about readmissions now, and this is critical to preventing readmissions, is the whole discharge planning process. So it also improves the coordination of services following discharge from hospital. So this was an article and a study done in Taiwan in the International Journal of Gerontology. So I thought that really encompassed the idea of discharge planning for me. So for this class, take a quick look at the objectives. For this class, when you're finished with this class, I hope you will be able to support evidence-based principles for discharge teaching and planning. I just picked random characters that I liked. Discuss the goals of discharge planning and teaching. Dance if you want. Describe the role of the case manager. Explain the role of the nurse in discharge teaching and planning. That's Kate running down the hall with a basketball. Locate documentation areas and power chart related to discharge teaching and planning. We'll talk more about that with the discharge teaching checklist of transplant patients. Plan teaching strategies to address special learning needs of patients and families. 2 more. Recognize innovations to improve the discharge planning process. And apply multidisciplinary discharge planning policies and procedures to complex case studies. So we're going to learn all of that today. A lot of you already have all of these skills, so this may just reinforce and boost your skills a little bit. So to start, we'll look at just the safety and quality aspects of discharge planning. So I just want to talk a little bit about the AHRQ, which is the Agency for Healthcare Research and Quality. It is part of the federal government, it's part of the Department of Health and Human Services, and it's a really good resource. Later I'll share the website. They have every statistic about every area of healthcare and nursing to help you understand like what areas are we doing well in healthcare and what areas do we need a lot of work. So there is a lot about readmissions, there's a lot of statistics, there's all kinds of research about anything you want to know about. So I did get a lot of information there about preventing readmissions and discharge planning in general. So they have a discharge planning model that they came out with in the past. It's called the IDEAL model. So you see there the IDEAL model stands for include the patient and the family in planning, discuss 5 key areas with the patient and the family, and I'll go into that in a minute. Educate the patient and the family, of course. Assess teaching outcomes and use teach back. So that's a big one that we hear about. And then listen to the patients and the family's concerns. So in that model, I mentioned the five key areas. I'll go over that quickly. So it's interesting because the 5 key areas apply to all of our care, but they also very specifically connect to discharge planning. So basically, patients are looking for us to describe what life at home will be like. So beyond discharge teaching, they really want us to help them understand what to expect at home, because usually they're pretty scared. And then, of course, the basics of reviewing the medications. That comes up in every research study about discharge planning and preventing readmissions, that they really want more and more information about their meds, and they want to understand it better, and they want us to give them that whole teach-back experience so that they can really feel comfortable. They want us to highlight the warning signs and problems. So for your unit, that would be the red flag signs that we put in our discharge instructions. So that relates to that. And then explain test results, which I hadn't seen that before. So basically, in order to go home and feel comfortable, one of the things they want to know is all the diagnostics and what does it all mean, and what kind of follow-up do I need related to that. So you may see in your discharge summaries now that they're including some more information about procedures that were done and test results. So that's one of the reasons why, because it's been identified as a quality and safety area that help patients to do better at home or wherever they need discharge to. And then of course, we've been hearing about the follow-up appointments. So making sure that the follow-up appointments, that they can get there, that the schedule makes sense to them, so that they're not missing appointments and they really do have true follow-up in a timely manner. So those are the 5 key areas, and of course you can see the connection to discharge planning for all of that. Back there again, and then I want to look at preventing readmissions. So again, this is not new, but it's good to highlight the readmissions because in this facility we do have some work to do to address readmissions, just like everywhere. Everyone in the country, all hospitals are working on this. So the reason I'm talking about causes of readmissions for this teaching is because if we can address the causes, we can reduce readmissions, and most of the causes are connected to the discharge planning process. So premature discharges, of course, that's not rocket science. But we are the key people to kind of highlight for the teams, you know, we see this as a problem, maybe there should be another 24 hours. So we would be the people that would flag, this might be premature. We might have to fight a little bit and advocate for our patients, and many of you have done that many times. So lack of care coordination, that's huge. That's what this whole presentation is about, is the care coordination that is involved in complex discharge planning. So that is one of the main causes of readmissions. Poor communication with outpatient providers. So they're looking for the teams to communicate better with PCPs, with nursing agencies, with anybody that's going to be following the patient on the outside. There needs to be improved communication from the hospital to the outside services. And lack of discussion with the patient about the plan. Again, we touched on that. Inability to keep follow-up appointments. We talked about that. And there's problems with patients not being aware of whom to contact after discharge. So we've done here discharge audits, and that's a big piece of the discharge audits, is to make sure that in the actual discharge instructions, there is a name and a phone number, not just to say, call your doctor or call the team. It needs to say the name of the person and the phone number and have off-hour contact numbers. So it sounds very, it's very detailed. It might even sound a little nitpicky, but these are actual things that they found that are connected to readmissions. So basically, it's not magic. Follow the evidence-based policies that we are seeing that show us what is good discharge planning and what prevents readmissions. And close the loop when you're communicating with the teams or communicating with an outside agency, and speak up for safety, which is what you do every day. And then good discharge planning is also connected to patient experience, very directly. So patients will talk about their experience, and they'll talk about the discharge teaching, the discharge process, how smoothly things went or not smoothly. So it's a direct piece of the patient experience. So President Obama's Affordable Care Act actually was in 2010, and they added some things to it through the years. So in 2014, it identified nurse-centered dimensions of patient satisfaction. So again, all of these can be connected to discharge planning. So communication about medicine, discharge information is obvious, and then planning the transition of care. So again, directly related to patient satisfaction and to quality and safety and preventing readmissions. So it's really a huge area for nurses to really take the lead in making sure that things are coordinated well for discharge. So before I talk about the nursing role, I'll talk about the case manager. So we have a wonderful case manager here. We all know her name is Ellen, and she has a huge job, and so some of her duties, I think this is pretty inclusive, but there's probably some things that are not on the list. Perform discharge planning evaluation. So pretty much for every patient that walks in the door, she is responsible to make some sort of an evaluation about what their needs might be. Once in a while, there aren't any needs, but as you all know, there's usually a lot of needs. So assist with patient discharge needs assessment, coordinate health insurance coverage, initiate and manage referrals for community agencies, educate patient and family about discharge planning, address equipment and supply needs, provide expert consultation related to discharge readiness, identify readmission risks. And this is a struggle, you know, for nursing as well as the case manager. Bringing up readmission risks in rounds, trying to get teams to listen, speaking up for safety. This is an area that we have to do some more work. And then the documentation of the discharge planning is a lot for the case manager, just like it is a lot for nursing as well. So who could know better more about wanting to go home than our little friend Dorothy? We know our kids really want to go home. That's the most important thing to them is, when am I getting out of here? So I thought that this was a good example of a kid that wanted